In this video, I'm going to show you the most asked paramedic interview questions and help you plan really great, strong answers that help you get the job. So let's look at a really important question that comes up in the vast majority of paramedic interviews, which is how would you handle a difficult patient? And what we want to do throughout this video is start thinking about how do you plan really, really great answers to help you get that job. So let's plan out a really strong answer that shows all of the values and all of the skills that they're looking for and helps you score well in this question. So the first thing that you're very clear about is getting the right value. So you say very strongly and very passionately that I always provide excellent care to all patients. So you immediately dismiss the idea of a difficult patient being a massive problem, and you say that as a paramedic, I provide great treatment to everyone. You then reassure them that you understand your obligations, that treatment is based on clinical needs. So if a patient is difficult, but they are in a serious emergency situation, you're going to prioritize the clinical need. You then reassure them again that you remain calm under pressure, which is a key skill that is essential for good paramedics. You then explain that you understand the causes of difficulty. So you know why patients are being difficult and you've got strategies to deal with that. So you're dealing with people that are in immense pain, that may be experiencing a lot of fear, anxiety, that there could be communication difficulties or a language barrier that has to be overcome. You can be dealing with people that have problems with substance misuse or that have completely unrealistic expectations that have to be managed effectively. Once you've talked about the cause of difficulty and that you understand why patients are difficult, you then explain that you adapt your practice to manage the causes of difficulty. So you know that patients are going to be difficult because of these things, and you say that you have strategies that you've learned from your experience and your training to help you effectively manage the reasons why patients are difficult, and that helps you to manage the situation. You then explain that I interact with all patients with compassion and understanding. And then you also reassure them that I seek support when needed and work to safeguard all people involved. So if a situation is dangerous, you may have to work with police, for example, to ensure that that situation doesn't escalate and that all relevant people are kept safe. Some other things that are worth mentioning is that you are always objective, that you don't take it personally. That's a key part of self-care, that if a patient is experiencing extreme pain and extreme fear, they may say very hurtful and offensive things, but you understand that it's not about you, that it's those difficulties and that extreme circumstance that is bringing that out, and that you empathize with patients that are in these situations, and that helps you to build a rapport, build a relationship, and help diffuse and de-escalate the situation. So you see how we've planned a really strong and clear answer that nails all of the key points. So take loads of notes throughout the video. That's really helpful, and be ready for this question and have a great answer ready. Now let's look at some other questions and start planning out similarly strong answers. So they could ask you, how would you inform a family that a patient has died? And the key is reassuring them that you're going to do it properly. This is a very serious thing to do, and it is not something you want to do in a bad way. So let's look at the key things that you say. So you reassure them that you're not just going to make up your own things, or you got your own magic system, that you always follow my training and I follow best practice. So people have done a lot of research on what the correct way is to deliver these messages, and you reassure them that whatever best practice is, whatever the guidance and training that you're provided with, that you're going to consistently follow that in an evidence-based way. You can then start to explain that you obviously assess family knowledge. You may be dealing with a situation where the family basically expects that the person is very likely to have died, or you could be walking into a situation where they have absolutely no idea that they're even ill at all. And those two situations are going to involve different strategies. So you want to have some idea what you're expecting. You need to be honest, you need to be timely, and you need to be accurate. So you have to ensure that you've got the correct facts and that the message is delivered at an appropriate time by an appropriate person in an appropriate way. That it should be done in private. So you want to take the family to one side, away from the immediate situation. You don't want to do it loudly in front of loads of other people watching. You want to do it in an appropriate situation where possible. Do not use euphemisms. Don't say that they've moved on, because they may think moved on to which room, or where are they, like physically. You need to be very, very clear that this person has died. They are dead. You need to use the correct language. Euphemisms cause confusion. you need to be very direct in this. You have to use clear and straightforward language. If they've died of something in a complicated medical sense, the complicated medical language is not going to be helpful in this situation unless they specifically ask about it. You want to just clearly explain in language that is understandable what happened. And then you want to allow time to ask questions. And you might need to be patient. There may be pauses and a lot of breaks where the information is being digested. And you want to, as far as possible, allow time to answer any questions that the family have immediately. So this is how you do it, and you're really clear on the fact that you do it compassionately and that you follow best practice and that you know how to deal with this sort of situation. The next question is one to watch out for. They ask things about, can you work weekends? Can you do night shifts? Can you do evenings? And you've always got to be very careful about this. So the ideal answer to can you work weekends is, I understand that paramedics are required round the clock, and I understand that weekend working will be a normal part of a paramedic's role. So you're not just saying yes, you're understanding that this is the reality of the job. And so you're suggesting that you're not going to be someone that's going to be particularly difficult, that this is quite a helpful thing. And you've always got to bear in mind that they ask this because they need it. If they're asking about specific times, you have to think these people sat and they planned out the interview questions and they said, we need to ask about the weekends. And that's because they think it's important. So if you say no, that of course is your choice. And if working on weekends is an absolute no, then you have to say no to it. But remember, it will harm your chance of getting the job. So as much as you can, you want to say yes to these because they've wrote this into the list of questions for a very good reason. The next question is, tell me about yourself, and people often waffle and talk about irrelevant things. They are not interested in these things. We want to focus all of the tell me about yourself on getting the job. So the things that they care about is your experience and your characteristics. They are trying to decide if you're the right person for the job, and this is your opportunity to tell them that you are the right person for the job. So talk first about your paramedic experience. If you have other experience, that's great, but that's not the most important experience. Talk about your healthcare experience after that. So if you've been a paramedic, that's the best experience. But if you worked in any other role within healthcare or any wider experience in healthcare, that strengthens your paramedic experience and gives you a wider base of experience that helps you stand out. Then wider experience is useful. If you've had other jobs, that's great. Try and link those back to being a paramedic. So you can talk about your paramedic experience and say, also, I've worked in here and I've found that this has helped me to be a better paramedic by, and explain how it makes you better. Then mention your training and CPD. If you have any certificates or extra qualifications, print those off, bring it with you. It's great evidence and it helps you stand out. And then any other training or any qualifications at all that you have that you think increase your chance of getting the job, help you stand out, now's a good time to mention it. Other things that you can mention in your answer are some of the characteristics that they're interested in. So you can describe yourself as friendly and approachable, that you build positive relationships with patients, that you are a respected and trusted team member and well regarded in your previous roles, that you work with great attention to detail, that you're highly reliable, that you have an excellent attendance track record. If you can back that up, that's really great to mention, that you're committed to continuous improvement, and that you love working as a paramedic because you're applying for a job as a paramedic. This is your career. Talk about it passionately. So use as much as you can on the right characteristics list. Just bullet point all the ones that match up to you, and then discuss your experience in detail, prioritizing your paramedic experience and then linking your other experiences back to being a great paramedic. And you'll have a really strong answer. And this is one that's definitely good to have a little bit of a script, to have a bullet pointed answer, because if it's asked, it's much better to be talking about a planned answer than trying to make something up. The next one I want to prepare you for is those sort of tell me about a time questions or describe a situation. They're a bit wishy-washy to start with, but with practice, you can actually have a good system of answering these. So use the STAR technique. If they say describe a time, you have to tell them what the time is. So situation, then what was the task? What do you have to do? Action, what did you do? And then the result, how did this work really well? That is how you deal with this. And we've got a situation where you worked under pressure. This, of course, is important to a paramedic. So you need to have an example ready. I'm going to give you a list of some examples that come up regularly, and I'll recommend that you have a go-to example in case these come up, and it'll help you give a more confident answer. So times when you're under pressure could be dealing with a very complicated case, dealing with a very aggressive patient, where you're understaffed and you're having to do a lot, where something's went wrong and you've had to come in and fix it. That's caused a lot of pressure. Or where you've had to make a quick decision, though, of course, pick a situation where you were under pressure to make a decision, but the decision you made was right and it had a good outcome. So for the situation, don't complicate it. Just say when and where it was, but remember confidentiality. If you divulge confidential or sensitive information about patients, you will blow the whole interview and they will not hire you. So don't name any patients or do anything silly, and explain why you're under pressure. Then the task, very, very simple. Explain what you needed to do to achieve a positive clinical outcome. Action, simply say, in order to ensure that this patient was well cared for and that the clinical issues were dealt with, I needed to do this, I needed to do this, I needed to do this. Just list the things that you needed to do and what you actually did. And then at the end, just explain the successful result, that you were able to resolve the situation, the patient survived, the patient scraped by because of your action, that it was very, very close to the line, but because of what you did, you actually saved a life, for example. That would be a great example. So have a time where you worked under pressure, ready to go. Use the list on the side to try and pick your answer, and I'd write that down. Some other ones that are really useful is they ask about stressful situations. They often ask, how do you deal with stress at work? How do you relax? How do you do that kind of self-care? A time where you had to deal with a really difficult patient, or a time, unfortunately, where you were presented with a negative outcome. I would think about having examples ready, because if they ask for any of those and you've got a go-to example, then it's really easy to answer it. And if you practice some examples and answering it, it will make you so much more confident for the interview. The next one is, where do you see yourself in 5 years? And I'll look at what a good answer has and what a bad answer has and give you loads of different things that you could say about where you see yourself in 5 years. And from that, you'll be able to piece together a really great answer. So the good things are, it has to be credible. Don't say anything silly. It undermines your credibility. Then any progression should be earned and not expected. So say, in 5 years, I will be doing this because I just expect it. You say, in 5 years, I want to be doing this, and in order to get there, this is what I'm looking to do. You then talk about learning and development. So what do you want to learn? How do you want to improve? Then you want to make the employer a key part of the story. So don't talk about doing something completely different, moving on, moving to a different employer. Talk about how you can do that with the place that you're applying to. Bad answers are things that are implausible or silly, that's off topic. Anything that is not relevant to the paramedic job, don't even bother mentioning it. Insulting the interviewer, saying things like, I'd like to be sitting on the other side of the table, or I'm looking to be taking on your role. That's not going to go down well. It might be that the person took 25 years to get to their level of seniority, and you're saying you're going to do it in 5 or less. Then anything that's irrelevant to being a good paramedic should not be mentioned, or anything that gives the idea you're going to leave the profession is absolutely the wrong thing to do. So let's look at the key things that you can talk about. So you can talk about the journey to +1. So where you are now, what is the next level? Is 5 years reasonable for that? Probably. And then you can discuss that you want to be taking on more responsibility over time once you're embedded in the organization, that you're really interested in mentoring and training new paramedics. And in 5 years' time, you want to be someone that is looked at as somebody that is highly, highly, highly competent and would be an ideal mentor to support new paramedics, because they know that if they pair them with you, they're going to be successful. That you want to take on a little bit more leadership, that you're interested in supervising, that you want to become an integral team leader. So within 5 years, you will have established yourself as an absolutely essential and highly skilled, highly competent member of staff that is completely dependable. You can talk about additional qualifications in CPD. Now is a great time to mention that, because they may actually, if you're successful, say, we noticed in your interview you've asked to do these courses, we would be able to offer that. Now is the time to ask. So if they want to hire you and you want some training, now is a good time to point out, I would like to develop knowledge in this and this area, and these are the specific courses that I think would be really great for my development. You want to mention being an outstanding paramedic. Of course, you want to say that I am already very, very competent, but I'm always continually looking to improve. And then maybe you're interested in specific career paths like becoming a specialist, particular interests that you have, a team leader, or even a consultant paramedic, or some other suitable role that you could achieve within that organization. So that is how you plan a really, really great, strong answer. This is another one that I would have bullet pointed out. So pick all the things on that list that match up to you, and then you'll have a successful answer to this. Before we finish, I'm going to show you some questions that you can ask at the end, and then present you with a list of technical questions that seem to come up quite frequently just to have answers ready for. So a good question that you could ask is, why did you choose this organization and what are your favorite parts of working here? And share their enthusiasm. You could ask if they could describe their service improvement priorities and ask how you could contribute to these as a paramedic, and discuss how you can be really effective in your role and help the management in achieving their goals as well. You could ask, can you tell me about the CPD program you have in place for your paramedics here? Show a real interest in your development. You could say, I'm very interested in the role and therefore would like to know the next steps in your paramedic hiring process. You probably want to know that, so might as well ask. And then thank the interviewer or the interview panel and be very clear that you are very interested in the job. Reiterate that you're a firm candidate if you are, and end as positively as possible. Never ask about pay. Don't try and delay your start date, and avoid answering any silly questions, asking any silly questions that could harm your chance of getting the job. Then before we finish, some technical questions. You obviously are a paramedic, you've been trained, you know the answers to these, but that's not going to impress them. Everybody else who's being interviewed knows that. How do you impress them? You talk about recent CPD. So you say, in answer to a question, I was recently on a CPD course and these are the things that I learned from that. So you're going beyond that. You talk about best practice, particularly if best practice has changed recently. So say, when I was training, we would have dealt with it this way. However, with ongoing research, we found that actually now is not what we do. We actually do it slightly differently. So it's a more effective way. So you're keeping up to date. So questions are things like, how do you deal with a heart attack correctly? Dealing with patient who faints, organization's core values, get those from the website, memorize them. The correct use of a defibrillator, and how to avoid hematomas when drawing blood. These are some of the most common questions that I've seen in people who have reported interviews. So I hope this video was really helpful to you and you feel more prepared for your paramedic interview. Please post in the comments below what questions you were asked. If it was helpful, please like and subscribe. And finally, thank you very much for watching.